We can always learn more about our patients. Whatever their situation is, their voice deserves to be heard, and we need to listen. What is it you need from us to make your experience the best it can be and for you to fully participate in the care that's offered at UCSF? I'm Amy Hyams, and I'm a patient experience partner here at UCSF. I was diagnosed with type 1 diabetes when I was 9 years old, and the diagnosis was presented in a really unfortunate way. I think the physician told me that I was broken inside and I would likely die by the time I was 35. So I grew up with a lot of stress around that. And that has really driven me to want people's experience in their healthcare journey to be a positive one. The Department of Patient Experience is actually fairly new. Only in the last 3 years have we really focused the efforts and hired a small but mighty team of patient experience partners. I get to work with clinical staff across the organization, whether it be physicians, admin staff, and I have opportunities to also work on things I'm passionate about, which is this work specifically with patients with disabilities. So at all of our sites, how can we make them as accessible as possible? How can we remove barriers for our patients with disabilities so that they can really access everything we have to offer? What can we do that's better than what the ADA calls for, that's really going to suit our patients? And 5+ years ago, I realized that there's no way currently in our electronic health record to document a disability and accommodations. There's no place that it's visible to everyone, meaning schedulers, people at front desks, nurses, doctors. So I've been working with a small group of stakeholders on what that documentation process would look like. That's really exciting to think that UCSF is going to potentially lead the way in having a very robust system for tracking ability status and accommodation needs for our patients. UCSF cares about people with disabilities, and we want to make this a welcoming environment for everyone. The same way I, as a patient, want to be heard by my care team, I want everybody else to have that opportunity.